Om Swastiastu, we are from SGD 6 and today we're gonna present it about prognostic aspects of intracerebral hemorrhage in children. Before we start our presentation, let me introduce our B6 member first. So these are our members. And today we're gonna present it about the introduction, which include background, problem formulation, objective, and the benefit of the study. And then there will be a content, which include research question, how to make a research question with PICO, and which journal that we use as the evidence, and then clinical appraisal for the evidence that we already choose. And the last one will be a summary. First, let me introduce myself. My name is Danissa Putri with relation number 005, and today I will present about the background information according intracerebral hemorrhage in children. So, ICH in children are a rare condition, and it is usually result from a rupture of blood vessel within the brain. According to a recently published systematic review and meta-analysis studies, the most frequent cause of pediatric ICH in children 2 years and older are brain arteriovenous malformation. Meanwhile, for children 2 years and younger are coagulation disorder. So, pediatric ICH is a challenging condition because the symptom can be non-specific. However, symptoms such as headache, generalized or focal seizure, focal neurological deficit, and sign of increasing intracranial pressure are usually presented in children with intracerebral hemorrhage. And if the children are strongly suspected with ICH, the first thing that we need to do are do a brain CT scan. If the diagnoses are positive, the next thing that we must do are intravascular imaging and fill out a score according to pediatric ICH. So that's all for me. Thank you.
Thank you for the opportunity given. Let me introduce myself. My name is Felicia Simorangkir with the last digit of my student ID is 098. Pediatric ICH significantly impacts neurological function and quality of life with outcomes ranging from full recovery to severe disability or death. Understanding long-term prognosis is critical for guiding treatment and providing families with accurate information about the child's potential for recovery and future challenges. The prognosis of ICH in children varies depending on factors such as the location and size of the hemorrhage, the underlying cause, and the speed of medical intervention. While some children regain full function after appropriate treatment and rehabilitation, others may suffer from lasting complications, including cognitive impairments, motor disabilities, and epilepsy. Early identification of risk factors for poor outcomes is essential for optimizing care and informing parental expectations about their child's quality of life after recovery. The problems that are based on the background of this paper can be formulated as follows. The first one, what type of question of the above scenario? What is the clinical research question that can be formulated based on the above scenario by using PICO method? What is the best evidence journal that can be found about children with intracerebral hemorrhage? How is the validity, importance, and the applicability of the journal? And the last one, how can we apply the journal in a clinical situation? The objectives of the study based on the problems formulation above can be formulated as follows. To understand how to build comprehensive research question using PICO method, to understand the effective searching method to find the best research evidence about long-term prognosis of pediatric intracerebral hemorrhage, and the last one, to understand the step to do a comprehensive critical appraisal by assessing the journal validity, importance, and applicability. The benefits that we want to obtain as medical student for the making of this paper are as below. The first one, to enhance our knowledge about step to find the best evidence journal and step to assess the applicability of journal. And the last one is to provide information about long-term prognosis of children with intracerebral hemorrhage. That's all from me. Thank you. The next slide will be presented by my colleague.
Hello, my name is Pande Putu Karina Candra with my last student digit number R240. And now I'll present you about the topic 2.1, identify what type of question of the above scenario. So this is a prognostic question. Here's why. First, it asks about the future outcome and quality of life for a patient 2 years old child after a specific condition, which is intracerebral hemorrhage. The second one, the focus is on understanding the long-term course of the disease and its impact. And then the question involved predicting future health outcome rather than asking about treatment, diagnosis, and etiology. And the last one is the doctor needs to find evidence base about what typically happens to children over time after experiencing intracerebral hemorrhage. Thank you.
My name is Gede Renathan with register student number 193, and now I will discuss about the clinical research question using PICO. For the population, we include the pediatric patient from 0 to 18 years with confirmed intracerebral hemorrhage from imaging such as CT or MRI, excluding the traumatic brain injuries or secondary hemorrhage. For the intervention, we'll see the Glasgow Coma Scale score, and then hematome volume and location with line shift on imaging, and then surgical intervention such as cranectomy, and then coagulopathy or underlying condition. And then for the comparison, varying exposure to prognostic factor, high versus low hematome volume, or surgical versus non-surgical management. And for the outcome, for the short-term outcomes, mortality during hospitalization, and then length of hospital or ICU stay. And then for the long-term outcomes, neurological sequelae such as motor deficits or epilepsy, quality of life, pediatric quality of life inventory, and then functional independence using WFIM. That's all from me. The next part will be continued by my friend. Thank you.
My name is Renathan with the last three digits of student ID number is 199. And I am here to formulate a clinical research question from the scenario above. And the clinical research question is, what is the long-term prognosis of child with intracerebral hemorrhage stroke without specific intervention compared to standard care or observation? Thank you.
My name is Sutedja with the last three-digit name 080, and I'm going to explain about the best evidence or article to answer this clinical question. So, an article by Bolois et al., 2021, entitled Mortality and Functional Outcome After Pediatric Intracerebral Hemorrhage, Cohort Study and Meta-Analysis is one of the most suitable articles to answer the previous research question.
First of all, let me introduce myself. My name is Adiwati with the last digit of student number 089. Now I'm going to present about the critical appraisal of this journal. First is the validity. The study's internal validity is strengthened by its comprehensive methodology, which combines a large cohort study with a systematic review and meta-analysis. It also uses validated outcome measures like the King's Outcome Scale for Childhood Head Injury and standardized diagnostic procedures like CT and MRI imaging. However, several factors restrict internal validity. One of this is that some cohort data is retrospective, making it vulnerable to information and selection bias. In addition, the meta-analysis heterogeneity compromises the accuracy of the results. And due to its large sample size and inclusion of data from various research, the study's external validity is significant and improves its generalizability to diverse pediatric patients with cerebral hemorrhage. However, as the study's cohort data came from a quaternary care facility, the findings are most relevant in high resource environments. Furthermore, the study's relevance to other pediatric subgroups and more recent developments is limited by the absence of neonatal population and reliance on data released up until 2019. Next, I'm going to explain about the importance. The study is statistically significant as can be seen from the p-value of less than 0.001. The study also offers complete information on functional outcomes and death rates, which are crucial for guiding family communication and medical care. When it comes to treatment plans and rehabilitation, the discovery that vascular lesions are linked to better outcomes while younger children with cardiac or hematological causes have worse prognosis is significant. Additionally, helping to establish acceptable goals for recovery, these findings emphasize the importance of early detection and treatment of high risk populations. It also highlights the significant burden of remaining neurological impairs and low recovery rates despite modern advances in care. That's all from me. Next slide will be presented by my colleague. Thank you.
Hello, my name is Leonyta Augustyne. The last three digits 150 and I'll explain about the study's applicability to critical analysis and support the discussion and outcome of pediatric intracerebral hemorrhage. The survey samples, size, and demographic diversity could influence the generalizability of the findings. The sample size shows that 231 children from the other stations were taken, but have not been explained to represent which specific geographic regions, and may not accurately reflect the experiences of all pediatric neurosurgeons across the different contexts. During the research period, the article highlights significant changes in clinical practices and patient management due to COVID-19, which does not extensively address the long-term implications of these changes on patient outcomes. Future research should focus on longitudinal studies on how to assess adaptations made during the pandemic might impact surgical practices and patient care in the long run. The rapidly evolving nature of the pandemic means that the data collecting during a specific time frame may quickly become outdated, potentially limiting its relevance for ongoing practice adjustment in pediatric neurosurgery. Overall, the article provides important preliminary data regarding to the impact of COVID-19 on pediatric neurosurgery. Its applicability is constrained by sample representativeness, temporal relevance, and a lack of focus on long-term outcomes. That is all for me. Thank you.
Hello, my name is Fernando Ghosali and my last digit of the number is 036. Now I'll critical appraisal about the journal that we found from searching web. So this research uses a combined design, a cohort study, and a systematic review with meta-analysis to approach the pediatric intracerebral hemorrhage outcomes. From the cohort, data were collected from children treated at a pediatric stroke center in France from 2000 to 2019. The study included 231 children with a median age of 9.6 years old. For the meta-analysis, this research used 19 studies identified through a PubMed search of articles published since 1990 to provide a comprehensive synthesis of existing research. And for the outcomes were assessed during using standardized follow-up tools, especially the King's Outcome Scale for Childhood Head Injury or COSCI to evaluate recovery. That's all from me. Thank you.
Thank you for the opportunity. My name is Zefanya with the last three digits of student number 166, and I will be continuing the presentation about the critical appraisal of the journal that we have found. Okay, so the mortality rate among children with pediatric intracerebral hemorrhage was 17.3% in this cohort, while the meta-analysis highlighted a pooled mortality rate between 12% and 24%, emphasizing the significant burden of this disease. And the functional outcomes revealed that only 27% of children fully recovered without residual symptoms, and among survivors, 57.4% achieved favorable outcomes, though many experienced residual neurological deficits. And the recovery rates were influenced by factors such as the child's age, the treatment setting, and the underlying cause of the hemorrhage. And this study demonstrated strength by combining perspective and retrospective data with meta-analysis, providing a broad perspective on pediatric intracerebral hemorrhage. And the outcomes were assessed using the King's Outcome Scale for the childhood head injury, and the large sample size enhanced the statistical power. But however, several limitations were also noted, which are high heterogeneity in the meta-analysis, which reflected differences in patient populations, healthcare settings, and treatment strategies. And additionally, the single centered data limited generalizability, and the extended time frame of 19 years introduced to potential inconsistencies in management strategies due to advances in treatment. So overall, this study highlights the significant burden of pediatric intracerebral hemorrhage, underscoring the need for improved therapeutic approaches and consistent management strategies over time. Thank you.
Hello everyone, my name is Karralika with the last digit of the number 246 and I will explain the next part. A study from Putri et al. Reported that death rate from intracerebral hemorrhage in children reached 9%, with more than all patients experiencing significant functional disability after 2 years. Factors like altered mental status, large bleeding volume, and duration of ICU stay reduced with significant functional disability after 2 years. Deeper understanding of the long-term impact and the factors that influence the prognosis can help doctors provide families with more accurate information regarding the chances of recovery. That is all from me. Thank you.
My name is Fernando Budianto with transcription to the number 161. I'll explain about the evidence for this journal. So, PNC study by Williams et al. In 2019 supports the finding of the journal by Bullis et al. In 2020. Bullis said that the mortality rate of 16.7% in children with PICH, emphasizing the severity of the condition, while Williams stated that mortality rate of 9% in pediatric neurological condition. The PNCC study support the higher mortality rate in PICH reported by Bullis et al. The second one is the long-term neurological deficits. Polo stated that majority of PICH survivors experience significant residual neurological deficits, while Williams et al. Said that 35% of survivors of pediatric neurocritical care acquire new disabilities, with 13% experiencing severe disabilities. This aligns with Polo et al. Emphasize on the high burden of long-term morbidity among PICH survivors. And the third one is the role of etiology in outcomes. The Bullis et al. In 2020 demonstrated that vascular etiologies were associated with better outcomes, while cardiac and hematological causes led to worse mortality and more severe visits. While Williams et al. Supported this conviction by showing that outcomes differ significantly based on the primary diagnosis, with conditions like stroke and inflammatory process being linked to worse functional impairment. And the last one is the shared emphasis on severity and heterogeneity of outcomes. So both studies underscore the severe impacts of pediatric neurological conditions, including mortality and long-term functional visits, while acknowledging variability in outcome based on diagnosis and individual factors. That's all from me. Thank you.
My name is Tiffany Cecilia with last digit number 170, and now I'll summary this paper. So, pediatric intracerebral hemorrhage is a rare but severe condition associated with significant morbidity and mortality. A study by Bowlus et al. Reported a 17.3% mortality rate and found that only 27% of survivors achieve full recovery, with many experiencing lasting deficits. Clinically, this evidence highlights the importance of early recognition, tailored intervention, and comprehensive rehabilitation. Despite advancement, PICH remains a critical challenge, requiring multidisciplinary efforts to enhance outcomes and provide better prognostic guidance for families. That's all from us. Thank you.